Pharmacokinetics, how the drug is absorbed, distributed, and eliminated.
Okay, so if we're giving a medicine, specifically a PO medicine, per oral, PO stands for per oral, is that where is that medicine going to be absorbed?
Liver.
I think it's going to be broken down in the stomach, but it's going to be absorbed in the small intestine. Okay? All right. You're going to read in your textbook first pass, second pass medications. I don't care about that. Okay? But I do want you to understand the difference between pharmacokinetics and pharmacodynamics. Now, what's pharmacodynamics?
Dynamics is its effect.
How is it working at the target tissue, right? How is it working when it reaches its destination? Let's use our buddy Narcan. How does Narcan get to its target tissue? It gets in the bloodstream, right? If it's atomized, it goes through the nasal mucosa, so it's a little bit slower of an absorption than intravenous, but it goes to our neurons in our brain, and it interferes with the receptor site between opiates and those receptors in our brain. It kind of causes a blockage where it doesn't match up, like the puzzle won't fit. That's how it works. So that's how it works at the target tissue, all right? So everybody understand the difference between pharmacokinetics? That's how it moves through the body. How does it get there? How does it get to its, how is it transformed? All that stuff. And then pharmacodynamics, how does it work on the target tissue? We're good with that. Any questions about that? You need to have a good understanding about those two things, okay? Another word that we talked about was bioequivalence. Y'all remember we talked about bioequivalence? So I want you to look up the definition for that so we can make sure you have a good understanding of what bioequivalence is. Don't you look in the back?
Well, I thought that was the whole thing.
Look, chapter 13, Armin.
Oh,
Relative therapeutic effectiveness of chemically equivalent drugs.
Okay.
It's a bioequivalence.
All right. So we've talked about calcium channel blockers, and we also talked about beta blockers. All right. Beta blocking, what are they blocking specifically? They're blocking what? We talked about alpha 1, alpha 2, beta 1, beta 2. Alpha 1 had to do with what?
Vasculature.
Vasculature. Did we worry about alpha 2? No, I don't care about alpha 2. Beta 1 was having to do everything with the heart. And then beta 2 was all about what?
The lungs.
The lungs. So beta 1 blocking agonist, right? It's a beta blocking drug or beta antagonist, all right? Because what it's doing is blocking that stuff. So what was the beta 1 stuff? It was automaticity, contractility. What else? No, that's all alpha 1. That's vasoconstriction.
oh, you said beta 1? Increase heart rate.
Decreases heart rate, decreases peripheral vascular resistance, decreases automaticity, decreases all those things. So what does a calcium channel blocker do? Well, a calcium channel blocker doesn't block calcium at the cellular membrane. What it does is impede it. When we say blocking, like potassium channel blocker, what's the potassium channel blocker? You don't remember? Amiodarone. Amiodarone is a calcium channel blocker. What is the sodium channel blocker? Lidocaine. Guys, we've gone all over this. I've identified all these blocking agents, right? You're like, yeah, Mel, it's so much information. We don't like it. I want to cry.
Yes.
All right. So one more time. Sodium blocking agent. What was a sodium blocking agent? Lidocaine. Calcium channel blocker. No! Carnosine!
Oh, calcium.
Oh my God.
We got a coffee pot in here.
Oh my God. Potassium channel blocker. Finally. Again, sodium channel blocker. Calcium channel blocker. Potassium channel blocker. Labetalol. Labetalol.
Benzodiazepine.
Beta blocker.
Or is it benzo?
No, beta
Beta
blocker.
blocker.
It's a beta blocker.
It's
Oh my god.
Beta blocking agent, labetalol, the LOLs.
Yeah.
Y'all are acting like I've never taught y'all this shit before. Y'all are stressing me the
Say it.
Just say it. Just say it.
fuck out.
Gonna air out this classroom.
All right?
Let me text Cable.
No. All right. I'm already into double digits. I ain't gonna get into triple digits, okay? It's just not gonna happen.
That'd be pretty cool.
All right. So, back to what was the initial word that we started on before we went down this rabbit hole? Bioequivalence. What was bioequivalence again? Ryan, help us out because you're the only one paying attention.
Relative therapeutic effectiveness of chemically equivalent drugs is their bioequivalence.
Okay. So you have a drug that's equivalent to it. They do the same thing, but they're a little bit different. They're bioequivalent. Okay? So calcium channel blocker is going to reduce heart rate, reduce blood pressure. True or false?
True.
Beta blocker drug. It's going to reduce heart rate and reduce blood pressure.
True.
That's bioequivalence. We cool now?
Yes, sir.
Do I dare ask those blocking agents again?
No.
All right. Okay. So far we've done how many terms? We've done 3 terms. All right, we got them under control.
Something like that.
All right. Okay. Cumulative effect. Look up cumulative effect. Somebody besides Ryan. Cumulative effect. And you need to be familiar with these definitions because they're National Registry stuff. All right. Ryan, did you find it?
No, I'm still looking.
I got it. Increase effectiveness.
Well, tell everybody what page you're on so we can follow along.
370.
370.
Fourth bullet point. Cumulative effect.
What is the bullet point heading?
Response to drug administration.
Oh.
Side effects. Response to drug.
All right, response to drug administration. There are a whole bunch of terms on page
370.
369 and 370. Let's go through them because you need to be familiar with them. All right, let's start over there with Big Lund. What's the first one on 369? What's the very first one?
Allergic reaction,
All right, allergic reaction. What does that mean?
also known as hypersensitivity. This effect occurs as the drug is antigenic and activates the immune system, causing effects that are normally more profound than seen in general population.
All right, let's talk about the things I've said about immune response and allergic reaction. Do you remember the word immunoglobulin? Do you remember the specific immunoglobulin? IgE is the immunoglobulin associated with this. Stimulates what type of cell?
Mast cells.
Mast cells that release what?
Histamine.
Histamine. And what does histamine do? Histamine causes that reaction where we have